And for those of you that are joining for the first time, welcome on behalf of my colleague Lucia Abascal and Naomi Baylor. We want to welcome you to this Reimagining Global Health Conversations for Change, which is a seminar series run by UCSF's Decolonizing Global Health Working Group. If you are joining for the first time, the goals of these sessions are to explore, discuss how and why global health needs to change by asking hard questions about the work that we do, how we're funded, the extent to which our research and programs perpetuate coloniality rather than advancing authentic global health equity. And this is actually the last in a series. We've now had a speaker each month, every month for the last 12 months, and we're going to take a hiatus over the summer. We've had some brilliant and critical thinkers help us ask hard questions about the way that we do global health research, how our research is extractive and perpetuates asymmetries in power and exacerbates inequities, how funding structures still perpetuate coloniality at institutions like UCSF and beyond. And finally, how academic institutions like the University of California need to do more to address the impact of colonization on the work that we do both locally and globally. And in that context, I wanted to start by pausing and reflecting on the ongoing coloniality here in California, and specifically acknowledge that the land on which I'm sitting, I'm here based in San Francisco in the outer Richmond, but also the land on which the University of California in San Francisco resides is the home of the indigenous people groups, several different indigenous people's groups over the last thousands of years, and here in San Francisco, the original people were the Ohlone, the Ramaytush Ohlone people, and I want to express my respect and gratitude to be here today on their traditional lands. I want to honor the Ramaytush Ohlone elders, past, present, and future, who call this place and the land that UCSF sits upon their home, and recognize that the Ohlone people are alive and flourishing members of the Bay Area community. We thank them for their stewardship and support, and hope that we can do more to strengthen our ties as we continue our relationship of mutual respect and understanding. That all said, there is definitely more that the university can be doing to redress past wrongs and heal the traumas caused here in California as well as in our global work. And we hope that this group can be a venue to address some of the ways that coloniality is perpetrated, and hope that this can be a venue for exploring new models for global health praxis, research and education. So in that context, I am really delighted to invite Sia Nowrojee to speak with us. Sia is the Senior Director of the Global Community at Girl Up, which is an initiative of the United Nations Foundation. Before that, she was the Executive Director of the 3D Program for Girls and Women at the UN Foundation, and we'll hear more shortly about her work. But in brief, Sia's work has included public policy, advocacy, training, capacity building, and strategic communications on gender, reproductive and sexual health, as well as HIV, education, economic development. Prior to joining Girl Up, as I mentioned, she worked at the 3D program at the UN Foundation, and in that capacity was actually instrumental in supporting transfer of that program to local partners. And it's partly with regards to that experience, how 3D worked itself out of a job by empowering local partners to do the work, that we're really interested to hear from Sia today. I believe, and I'll stand corrected, that process of transferring power was also required her to find a new role for herself, which I think is a very vulnerable position to put oneself in professionally. And I'm really curious to hear from her on that. But very excited to have you here with us, Sia, so thank you. Before you begin, just a word on format. We will have 25 minutes of presentation, and then we want to make this as discursive as possible. So please add your questions to the chat, or tag Naomi, Lucia, or myself if you have questions, and we can moderate those questions with Sia after she's shared her presentation. But without further ado, thank you, Sia, for being with us today. The mic is yours. Over to you. Thank you.
Thanks so much, Mike. It's really a pleasure to be here. And thank you to everyone who showed up. I know that Zoom fatigue is real. I also know it's the end of the academic year, so it's hard. And it's also, for me, it's kind of a brown bag lunchtime, but I know for those of you in the Bay Area, it's also sort of a funny time to join. So thanks for joining. And I am looking forward really to having some good discussion and to learning from all of you and hearing your questions. I'm going to share my screen and then just jump right into it. I think when I'm sharing, I won't be able to see anyone. So if there's anything really top of mind or urgent, just shout out. Otherwise, I'll go through my slides and then happy to go into discussion. Okay, if someone can just say out loud that they can see my slides.
Your slides look good. You're good to go, Sia.
Wonderful. So Mike, thanks again for the very kind introduction. I'm really pleased to be here to share some of the experiences that we had and some of the lessons that we've begun to, well, that we learned and continue to learn from the process of the 3D program, both in sort of how we worked in India and also how we sunsetted the program from the DC perspective and really handed over to our partners. I think, you know, the process we completed the process last year. We continue to work with our partners and support them informally, and we continue to learn together and are really sort of pleased to participate in discussions about decolonization and localization, and really sort of trying to gain understanding of what those things mean beyond the rhetoric and beyond the terminology for those of us working in international development and global health. And I really think it's a work in progress. So I'll be essentially sharing sort of the case study of the 3D program, you know, what we learned, what we continue to learn that are continuing to inform discussions and processes of decolonization and as your series puts it so beautifully, reimagining global health. So from 2017 to 2021, the 3D program really focused on advancing gender equality through engagement with local government in both urban and rural Maharashtra in India. And we brought together local government officials with civil society, particularly women's organizations and collectives, as well as the private sector, to really strengthen women's voices and create and strengthen platforms that could hold government accountable in the provision of services. And we focused broadly on economic empowerment, health, education, and public safety, which is a lot, I know, and that agenda was really informed by the priorities that girls and women were bringing to us through our partners. We were going along happily for 3 years, and in 2020, as you all know, COVID hit, and we really sort of stopped, took a hard look at ourselves and what we were doing and what we could do better, and we made the decision as a DC-based team to step away. And as I said, the backdrop of that decision was really, COVID gave us all this collective moment to sort of say, how are we working and how could we work better? And understanding that the resources for our programs were needed elsewhere in the moment of COVID response and urgent COVID response. And so we pivoted. We realized actually that the models we had put into place were working because they actually worked through COVID. So through the women's collectives and platforms that we put in place, through the connections we'd made between women working at the community level and local government, we were seeing the delivery of services, the sort of last mile delivery of supplies, And then we were also collecting data from women that was being fed to back to local government. And so it was very validating in a way that our model was working. But as a DC team, we had to think really carefully about whether we needed to be in the picture anymore, and whether there was a better use for our funds and our resources. And of course, this thought process was really informed by the global reckoning around social justice and international development, which again was very validating in the way that we were thinking about the need to step back. And in many ways, we had it easy because we had wonderful partners, and our partnerships were really rooted in deep respect and trust, and we could have really honest conversations with each other about what we thought we should be doing, when we should be doing it, and how we should be doing it. Just to step back a little bit, before COVID hit, I wanted to take you through how we worked. And we worked pretty typically like a sort of typical international NGO. We had a Washington, DC based team, which sort of led on strategy. We provided most of the funding. All of our funding was coming from the Bill and Melinda Gates Foundation. And so we did the direct interface with our donor. We had a consortium of partners in Pune city and rural Pune district in Maharashtra, which led on implementation, but we really sort of positioned our partnerships as equally as we could in terms of strategy. So our partners were really instrumental in guiding our strategy and ground truthing it, and sort of telling us when we were going wrong and when we needed to course correct or switch gears. We had an Indian Program Advisory Committee that was multi-sectoral. We had government officials on that committee, private sector representatives, feminists, other NGO and civil society members, and also members of academia. We were consultative and really focused on strengthening our partnerships, and I'll say a little bit more about that in a minute. But we also did have some parameters. We went in with a particular model that we wanted to try, which was that we wanted to try and challenge the siloing of programming when it came to gender equality. And we wanted to make people who didn't usually talk to each other. And so this was challenging, as you can imagine, for government officials who are in their lane and stick to it and are accountable to politicians, and it was also challenging for our civil society partners, and particularly feminist partners who had deep distrust of government and the private sector. But we did that was our agenda that we pushed. And in similar ways, our partners pushed back, and we kind of met on the middle on certain things. But that's sort of how I would define the way we worked, which was consultative, within these parameters. We had really consistent online and phone communication. We would speak with our partners at least once a week. And pre-COVID, the DC team was going to India maybe 3 or 4 times a year for a significant amount of time. And most of that time was actually spent with our partners. So a key part of how we worked was really centering partnerships, and partnerships were at the heart of both how we were working, in that we weren't doing anything without consulting our partners. Our partners were the implementers of our strategy, and they were, as I said, a pretty diverse group of local government partners, civil society, women's collectives, feminist organizations, and private sector representatives as well. We sort of held to the sort of principles of the movement of community-led development, principles of collaboration, which were shared purpose, adaptability, respect, and mutual accountability, which also reflect the methodology of collective impact, which is bringing together diverse partners. Everyone doesn't have to be doing everything all the time, but we have to have a clear sense of why we're at the table and what our shared purpose is as well. And then we are holding each other accountable. In our partnerships, we relied on feminist approaches to relationship and trust building. We actively sought out feminist organizations whose values aligned with ours. We were very aware that we were bringing our main partnership was a North-South partnership of a DC-based team and Indian-based teams. Because we were trying to break through sectors and silos of sectors, we were creating multi-sectoral partnerships as part of our methodology. And often these were unlikely partnerships. So we would have a corporate partner working with a feminist organization, the transportation department working with the education department in local government, really folks who didn't usually talk to each other. And so it was very dynamic, very exciting, but partnerships are all about people. So it was also, it required a lot of focus and work. And we soon realized that actually was the bulk of our work, was fostering and supporting and stewarding these partnerships. So as I said, when we stepped back and we made the decision to step back, we really relied on those partnerships to sort of carry us forward. And we designed a 3-phase process to transition ownership. When we made the initial decision in Washington, DC, we realized we had to talk to the partners in India. Did it make sense? Was our instinct right? And so we did our stakeholder analysis. We sort of sorted out who is it we needed to talk to, who did we need to get on board if we were going to do this. We assessed our resources. What were the resources we needed to hold for our DC operations to get us to a point of transfer? And what were the ones we could just transfer over as soon as possible? And remember, this was really at the beginning of COVID, and if you remember, India was really hit hard. So there was a real urgency, and we felt it, and we wanted to get as many resources, you know, the travel funds we weren't using, the meeting funds we weren't using. We were trying to sort of get those to partners as soon as possible to do all the crisis interventions that they were doing and needed to do. We had really in-depth conversations with partners, one-on-one, in groups. We held virtual retreats and really sort of touched on our implementing partners, of course, our donor, the Gates Foundation, our advisory committee, and then our host institution, which is UN Foundation, where I still am. So that was phase 1, was really getting buy-in and strategy. And then the next phase was planning and action and being as intentional and strategic as possible. So coming up with a work plan for us, for the DC team, how do we wrap up our role in programs? How do we wrap up our operations? Working with each partner to create strategic plans, getting the funds reallocated once we had the plans to say, okay, now we know the budget, we can now reallocate the funds to partners. And as Mike said, that realization that we were working ourselves out of jobs. And so we began our job searches, and we made a pledge to each other that we would do whatever we could to support each other, serve as references, make each other available for interviews, share job announcements, you know, everything that we could to be transparent and make that part of the work so that it wasn't something we had to do behind the scenes. It wasn't something we had to feel apologetic about. Then for each partner, in addition to a strategic plan, we tried to come up with a fundraising plan. And we really tried to leverage our own contacts in terms of sort of big global funding. And then we're working with the India partners to sort of identify in country who were the funders available that might, that could pan out. And then phase 3 was really sort of completion and reflection. So, and some of these are still in progress as we all sort of come out of COVID. But it was important for our partners to get some local government approvals to move forward without us. So we had to sort of take ourselves out of the approvals that we'd already gained. Funds secured. Some funds were secured. Last week I was helping a partner with a proposal, so it's still ongoing. And I really do think as folks are moving out of the crisis phase for COVID and into building back and into sort of reconstruction, there are more funds available and there's more attention from donors for the program. So it's very much a work in progress. Documenting and sharing lessons learned, here I am. We've been doing it since we started the process, and I imagine we'll continue to do that. Very, very happy to say that all 4 members of the DC team are gainfully employed, and in fact, one of them had her confirmation hearing as a nomination with the Biden administration for Global Ambassador for Women's Issues at the State Department today. So that worked out well. And then finally, just closing the DC operations, which happened officially last summer. So there was this 3-phase process to transition ownership. But as we were going through it, we really realized there were actually 3 streams of work. There was the programmatic work of, how do we hand over the program? What components of the work we've been doing did the partners want to take forward and build on and scale up? What were those they wanted to let go of? And then the second stream of work, of course, was operational. So budgets and making sure there was capacity and making sure the partners had the staff they needed. And again, sort of extricating ourselves. But the third stream of work, which was just as important, I think, was the emotional work that we had to do. And we realized pretty early that we needed to create the space to grieve the end of something we all cared very deeply about, the DC team and the Indian partners, to allow ourselves to celebrate as well, to allow ourselves to be optimistic in a moment that was not optimistic at all. And that has been sort of a through line of, when we talk to our partners today, it's the same questions. How's it going? How's the fundraising going? How are you doing with all of this? And when we reconnect in DC, it's those same questions. How's the new job? How are you feeling about it? How are you feeling about your trajectory? And how do you feel about, how do you feel looking back at the 3D program? So it's been a really sort of key part of the transfer program process. And again, I think that was enriched by the quality and the scope of our partnerships. So I'm happy to answer questions about that process as well, but just wanted to spend a little bit of time before I close sort of on some of the lessons that we have distilled and continue to think about for global health in particular. And the first one is looking back and what was really driving that initial instinct to step back was this need to, I think we all need to sort of disrupt this funder implementing model. And often the model is that the partners in the global north typically bring in and control the financial resources. And that's true. It's kind of it's a reality of the inequities in the world. It's the reality of the fields that we work in. But to sort of disrupt that, it is really important that local partners are not simply involved as implementers, because, and this is something we discussed with our partners, that model really establishes sort of a caste system which distinguishes who's leading, who's bringing the intellectual capital, who's bringing the money, and then who's actually doing the work. So disrupting that and making sure that we're all playing those different roles to the extent that is drawing on our strength is one of the really important lessons that we got. So what we did was involving local partners in strategic decision making from the beginning about how to allocate and reallocate and utilize funds then throughout the lifespan of the program. And that sometimes meant not doing what we wanted to do and really listening. And one example of that is that we had said from the beginning that we believed that government was an important partner. And as I've mentioned, there is great distrust of government, particularly among feminist organizations in India, and rightly so. But we really felt that without government as a key partner who had bought into the model, we wouldn't be able to reach girls and women at scale in a sustainable way. And so our approach was to sort of go to the top. We went to the national government officials, then we went to the state government officials, went to the district government officials, and we were getting ready to root our programming at the district level. And our partners came out loudly and clearly and said, no, it actually has to be at the village level, because unless you put village women, or at the slum level in our urban program, unless you put local women in the driving seat of this model to hold government accountable, it's not going to work. And if you put the power first with the district government officials, you're simply reinforcing power. And so that was an example really of how we listened to our partners, and thank goodness we did, because of course they were right. So really disrupting that model, and being optimistic about it, that really, even if we are responsible for reporting back to the donors, we should be trusting our partners to be in the driving seat, and helping us make some really key decisions. A second lesson, I've already talked about this a lot, is really the partnership angle, and building strong relationships is critical to fostering trust and strengthening programs. So working across borders, working across issues, working across financial and other resources really does require trust. And so, as I've already mentioned, finding and committing to a shared vision is really a critical part of building that trust. And then investing in people and relationships by building in the time and space to connect with and learn from each other. So as I've mentioned, when the team would go to India, really a large part of our time was spent with our partners, strategizing, getting to know each other, listening to each other, disagreeing, planning, replanning. And that was something I think we did instinctively. But towards the end of the program, we realized, okay, we really just need to build in this time to do this. And what we found, particularly, well, we found it throughout, but particularly in the process of transferring ownership, was that those strong relationships that were built on mutual trust, built on equality and true affection, really helped us to get through the bumpy times, including the transition. So to get us through really honest discussions about differences in approaches, through some frank dialogue and collective learning. And again, to get us through that process of saying, okay, we are not going to work together anymore. And how do we do this in the best way possible, that really honors the work that we've done so far. A third lesson was really understanding that while we brought resources and privilege and the UN Foundation name, which certainly opened doors with government officials, private sector, and other stakeholders, what really worked well about our program and what was the core of it was creating opportunities for people to speak for themselves and for those in power to listen. So we all know that gathering and sharing evidence is a key pillar of global health practice. That's what really guides development of programs, policies, resource allocation and budgets, and the advocacy that we do. And so we sort of took that tenet and through the platforms that we built, which were essentially strengthening women's collectives, we created opportunities for girls and women to speak for themselves. But we also created opportunities for them to speak directly to those who are mandated to serve them. And we heard both from girls and women and from government officials who said how well that worked and how powerful that was. Because while girls and women may have been speaking to each other or to some of the local officials, often they didn't know that that official had a boss or that that official had clear responsibilities to serve them. And so that was sort of an eye-opening revelation for them. And then we heard from government officials who said, look, we just never have the time for this. There's no mechanism in place where we can actually hear directly from girls and women. So that generation of data and evidence about how programs were working and having that direct through line for girls and women to speak for themselves and to those who are accountable to them, really in the end actually was a way that strengthened our program, and I think strengthened our outcomes as well. It was also a way for us as international development, global health practitioners to sort of model how you shift power dynamics and how you could work differently. The fourth one, I'm sure you've all heard, we've all been hearing this, particularly since the summer of 2020, is diversity is a strength. So the more the different perspectives you have around the table, you are going to generate more ideas. You're going to have different and stronger insights, and you'll be able to do that cross-fertilization that happens only when worlds collide. And so building that into our methodology and our program design really strengthened our program and our interventions and ultimately our outcomes. And the final one is sort of linked to number one, which is move beyond binary thinking. So move beyond north-south, funder, implementer, and rather than this north versus south model, as we're thinking about decolonization, we really sort of came to the point where we understood that global health and international development would benefit from a shared lessons learned model. And this was particularly evident in India, where I think like everywhere now, the income inequity is making it clear that inequalities exist everywhere, and everywhere can be doing better. And there are lessons to be learned from successes in the South, from struggles in the North. And so this North versus South model is not necessarily serving us well as we're trying to reimagine these processes and systems. Another thing which was very true for our team is that many of us working in global health actually straddle various social identities, and we bring those to our work. So before I was executive director, our executive director, who became our senior advisor, was born and grew up in India and moved to the US as a young professional. I am of Indian origin, but grew up in East Africa, have family in Maharashtra. There were times it was very clear that things felt very familiar and I was very comfortable. And there were times when I felt like I was an outsider. But it was just never, again, this clear binary north-south, insider, outsider. That wasn't true for us. And I think that's true for many of us working in global health. Well, we are all bringing our various social identities to the table, and that influences how we work. And we need to sort of get past the binary, I think. And we can learn, I think, from the movements on for social justice, where those are the strongest movements that are saying, being intersectional is what really will get us where we need to be. We can't solve climate change without looking at gender equality. We can't look at health equity without looking at the rights of LGBTQI communities. And we can't look at vaccine equity without looking at global structures and inequalities. So really, I think it's all a bit of a mess, but in that mess is so much opportunity if we can get beyond the binary. So these are sort of the key lessons that we've had. We're of course in touch with our partners. We're continuing to learn from and with them, and are contributing to discussions like this. We are part of the movement for community-led development, which is doing some really great work around being intentional and around decolonization and what localization means. We've also participated in events with the Stopping a Success Consortium, which is also moving forward some really important discussions across geographies and fields around decolonization. And although I am not an academic, so really excited to hear from all of you, myself and one of our partners in India is actually working on a chapter for a textbook on global health and working in a changing world. So this, as you probably have guessed, is very close to my heart, and I'm looking forward to hearing from all of you. So thank you.
Thanks, Sia. Mike, do you want to go ahead?
Oh, sure. Sia, thanks so much. Well, no, Lucia, you ask your first question if you have one. I don't want to jump in if you have something you want to say.
Yeah, I guess like the burning question I wanted to interrupt you with during your presentation, it was like, what did your partners say? What was their opinion when you first started talking about this with them? So how did they take it? Like, I'm just curious about their reaction, because I know these changes can be really big.
Thank you, Lucia. Yeah, it was, there were tears all around. I mean, I think partly, you know, everyone understood the realities that we were facing, but we also realized, we all knew what we were losing, and they did as well. And in our first proposal to them, I had a slide which said every ending is a beginning. And as soon as I put it up, everyone was like, Sia, what are you doing? What are you talking about? And we're like, wait, this is just a conversation, but really this is what feels like makes sense. Yeah, it was emotional. It was very emotional.
But they were.
Lucia, you've frozen.
Yeah, I lost you there, Lucia. See if we can get your internet back. Can you repeat, Lucia? We missed you there.
Yeah. That's why I had also my camera off. But no, yeah, I mean, besides the emotional part of like stopping to working with people that you like were they like happy, like they thought they could do it? Like I like
yes.
Okay.
Yeah, I mean, there was no question they could do it. They were doing it anyway. The question is, how could we get them the resources to continue to do it, both through COVID, but also in a way that would be sustainable and they could think about even beyond COVID. So I think those were kind of the questions of how are we going to do this? Because we were all working in a time and space that none of us had experienced. And we didn't want it just to be about that COVID pivot. We wanted it to be about really sustaining an approach and programming that we had seen even in 3 years was making a difference in the lives of girls and women. So absolutely no question they could do it. I mean, despite what I said, they were the implementers. They were the ones already working at the village and slum level. I think what I appreciated was, I mean, I didn't expect any different, but there was no question that they were just going to take the money and run. There was this real interest in continuing to engage with us and go through a planning process that would leave them in a good place to continue the work. I hope that answers.
Yeah. Perfect. Thank you.
Before I ask my question, just to sort of preface it by saying, if anybody else wants to ask Sia a question, please, come off mute. We're a small group. I think that would be fine. But Sia, I wanted to zoom out a moment and really kind of ask you to sort of address, if you can, what I think for many is sort of an existential crisis at the heart of global health, which is, whilst nobody would contend that the trajectory that you went on in terms of like empowering your local partners and relinquishing your responsibility, it was the right thing to do. You did yourself out of a job, quite literally. and I think like in the academic space, that's a big concern. You know, a lot of our faculty and staff are involved with capacity building initiatives, mentoring mentors, and establishing programs. And we're all sort of teleologically kind of committed to this goal of ensuring that at the end of the project, our partners are able to do it without us. But at the same time, it's very hard to sort of relinquish our tight grip on these programs because it affects our bottom line, right? People's salaries, people's career advancement is predicated on continuing to run programs as they are. And I'm just curious, like, you know, how do you think about this for global health more generally? Yours is probably the exception rather than the rule right now. Is there a role for global health, you know, and for partners in the global north to continue to support things that are incredibly important in other settings, even when it hurts our bottom line? Any thoughts on this would be appreciated.
That is existential, Mike. I'll do my best. I think there absolutely is a role for global health, and there's absolutely a role for partners in the global north. Is that role going to be the same as it's always been? I don't think so. I mean, there are some realities that are, yes, there are shifts. They're not huge shifts. But I think for a while, we are going to hold the resources in the global north. There is some reallocation, but it's not going as fast as maybe it should, and maybe that's okay if it's going to be done sustainably. I think it goes back to not thinking about this in a binary way. I mean, when I think about privilege, I know as a Kenyan and having worked in India that there is extreme privilege and inequalities within the global south. And so, as I said, I think everyone can do better. The role of the partners in the global north, I think, should be looking a little bit inwards and looking at our institutions and how we can do better. And maybe that's where the risk taking comes, because we have to speak out, or we have to step back, or we have to challenge the way things have always been done. But do I imagine a world where there are no global health programs in the global north? No, there's such a role for that. These are places where people come together from all over the world, and there's such a rich exchange of ideas, and important connections are made. So I really do think that, you know, the upside of globalization is that we are a global community, and that each of us has a role in making things better. I think there are some pitfalls to avoid. I have seen some approaches where there isn't as much accountability for partners in the global south. There's kind of an apologetic approach now, which I don't think we should be doing. You know, I think we should offer what we can, hold to high standards. And I think if we are centering partnerships and really sort of healthy partnerships, putting the investments there, my hope is that those partnerships could hold us accountable to all doing better.
A follow-on question again, if anybody else wants to jump in, please do. But you know, you mentioned like the three dimensions to that transition: programs, operations, and emotional. And I'm curious if there were sort of key performance indicators or benchmarks that you looked at to make sure that you are doing that transition in an appropriate way, where resources were stewarded appropriately, and you didn't kind of overwhelm your partners too quickly. I think, you know, certainly on our programs, we're really interested in trying to do that, but you know, trying to figure out the way to do that at a cadence that is responsible and builds capacity even in the transition process is something that I think we're interested in figuring out. So any wisdom there would be appreciated.
Yeah, I mean, I think that was why we realized that we wanted each partner to have a strategic plan. And we weren't going to put that burden on them. We were going to sort of co-create that with them. And as part of that, we could then look at the funds and say, okay, who's taking forward what, and work on a budget jointly with them that made sense. So it wasn't just sort of a dumping of funds without sort of those guardrails of a clear plan forward. Again, Mike, I do think we had it easy. I mean, we really completely trusted our partners, you know, so, and I know that's not always the case. So, you know, that's just reality, but it was important. We tried to do it in as rigorous a way as we could.
And I have one last question, so anybody else jump in. But to what extent is the funder responsible for catalyzing this versus, you know, your partners on the ground or you in DC? You know, obviously funders are also kind of conflicted. You know, particularly U.S. government, as an example, that they want to see investments that benefit US organizations sometimes, and I'm curious how the relationship between the funder in that transition process for the 3D program.
For us, it was really us and going to the Gates Foundation and saying, look, this is what we want to do, and they were, to their credit, incredibly flexible. And in fact, when they asked us for our COVID contingency plan, it was sort of, you know, do what you want. We realized that everything is different now. So we were sort of steering that ship. I mean, I think the reality is kind of through those discussions, we realized we probably wouldn't have gotten renewal of funding for a DC team, since we were showing that the work was being done and could be moved forward without us. So in that sense, there was that reality that was donor driven. More broadly, Mike, I think it's different. I mean, I think there are donors. For example, Open Society Foundation has completely restructured the way it funds. There are programs that are government and Gates funded, like FP 2030, which has completely restructured the way they work, which means the funds are now primarily going to the regions and not the headquarters. And other programs are sort of doing similar things. So I think people are trying different things. And that's why I think these conversations are just really important and also fascinating to see the different pathways different organizations are taking.
Any other comments or reflections for Sia from the group?
I guess my question was going to be very similar to yours, Mike, and I think that's the researchers in us about just like continuing to measure impact and comparing performance between like before and after the transition. But Sia answered that really good, so no other questions from me.
I do think, Lucia, that the M&E is also shifting, right? Like what's a reasonable outcome? What's a reasonable indicator? What's an indicator that makes sense for us in the global north versus an indicator that makes sense on the ground in a program in the global south? So I think that's a really important space to watch as well.
It would be super interesting also to hear back about how how that changed with the transition. Yeah, if you like have concrete examples.
Well, we just stepped back, so no one is reporting anything to us except informally. What has happened is we are continuing to sort of support and be a sounding board as they raise funds. So they are, if it's sort of a funder based in the global north, they may reach out and say, you know, how do we talk about this kind of indicator? How do we fulfill these reporting requirements? Because that's what we did. You know, that was a key part of our role. With national and local funders, they're just moving forward themselves. Yeah.
Any other comments for Sia? If not, we're close to the top of the hour anyway. So let me just wrap up and state emphatically how grateful we are for your perspective, Sia, and the the risk that you and your colleagues took is a great model. I really appreciated your perspective on the need to disrupt the funder implementer model and really center programs around local partners for sustainability and impact. And then I do think, just to go back to something you said, insofar as the role of the Global North in ongoing sort of development activities, we don't live single issue lives, right? We bring multiple dimensions of intersectionality and expertise to our professional lives, and I think in that sense we have a lot to contribute, even as global health transitions into this new space, which is sort of what I think you said far more eloquently than I did. Thank you so much for your time today. Really great to have your perspective.
Thank you so much, Mike. Thanks, everyone. It was a pleasure to be here. Bye-bye.
Thanks, guys.
Bye.